I'm asleep. My whole body is naked, and there's 10 people in a room, all hovering over me. Hi, everybody. It's Lola. It is May 27th. It is a Monday, and I'm just chilling at home. I just wanted to do this very, very intimately. I just want to talk openly and not really feel like I have to present or stage a video. So I just want to talk about my surgery and give you a little bit of information and updates while I'm having my tracheal shave surgery tomorrow morning. I just want to chill out tonight. I wanted to do some cleansing while I'm going to heal. And by cleansing, I mean I want to eat clean. Um, I did buy some pizza. But I want to have some smoothies and mostly have like a smoothie, fruit, veggie kind of green diet over the next 3 days. Just because I know that a lot of the medicine from the pain medicine will affect my digestion, from what I remember when I had my wisdom teeth out. So I'm hoping that when I eat a little bit more vegetables and fruit, I'll have a little bit better time in healing, and I will see you tomorrow, and I'm going to let you have this experience with me. I hope you continue to watch this video. I wanted to also show you just what my Adam's apple looks like. Without any lighting, without any like photography tricks or anything. When I'm talking, you can kind of tell it's right here. I kind of have like a double chin, but from the side, when I can make it move, it's really not it's really not that big of a difference or that noticeable. But ooh, I'm so tired. But it is something that I know is very recognizable about my body that people will be able to see and be able to target me and be like, oh yeah, I've seen Adam's apple, so that's probably a boy. And this is just going to be a 45-minute procedure, and I'll probably be under anesthesia a little bit better. So if you want to watch my adventure, continue. Bye. Hi, I just wanted to show you some stuff that I got. These are some blotting linens, and they're made out of charcoal. So the thing is, we can't really wash too much. You can't really wash your face, so I feel like I'm going to get really oily, and this is going to be really good when I can't wash my face. This Scar Away is going to be really good for working on my scars after I'm healing. They come in really big patches. I wasn't sure how big my scar was going to be, but it's a 6-month supply, which means I can wear it for 12 hours. So when I use this, I'll be able to just keep it on overnight, and I don't have to wear it during the day. The other thing is I have to use a special shampoo and or body wash. It's a skin cleanser, and this is like an antibacterial, so antimicrobial. And I have to wash tonight, and then I have to wash tomorrow morning before I go to the hospital. The other thing is these ice packs. There's a couple of 4. I don't think I need all 4, but for my other surgeries, I'm going to. And this is a little bit of a wrap. So I can put the one ice pack in here, and then one ice pack in here, and the other 2 will be frozen. So I can switch them out. But I can just put one right here and then wrap this around my neck, or just have this lightly around my neck while I'm processing. I'm sorry, not processing. I'm like, not working. I'll leave the name of this. This one's called Body Pros. Good morning. It is Tuesday the 28th. It's 5:35. I'm waiting for my friend to pick me up. I just showered. I had to use this cleanser called Heba Cleanse, and it's like putting or rubbing alcohol on your body. It's really weird. It doesn't lather. It's just like an ointment. It was just really trippy. I'm not nervous, but I just took a little bit of a CBD tincture to chill out. In case I get a little bit anxious. I'm more nervous about driving because I get motion sick, and it's kind of like a big issue. I'm not taking any of my medications today because the doctor wanted me to not have anything interfere with my blood levels. So this is me without any product in my hair. I just showered and I blow dried it so I'm not sopping wet. I don't know. Until my friend gets here and go to the hospital. I'll see you in a bit. Hi. I just got my IV from the nurse. I'm just waiting. I got a warm blanket, and I'm just waiting for the doctor to come talk to me. I have like 45 minutes before I go into surgery, and it'll be chill. I'm just hanging with my friend Paolo, and everything should be fine. But I will see you on the other side.
Can keep up on for 3 days, up to 2 to 3 days. But if side effects bother you more than not,
Scar is gonna be perfect. I thought it was gonna be more visible, but it's gonna be like. Hi everybody, I'm home. It's about 12 o'clock and she's snatched. Not really. I'm on some oxycodone, codeine, and I have shit all over my face. But my surgery went well, and I have this little patch for a day, and then I have an anti-nausea patch on my ear because I get really sick, and I'm just gonna relax. I thought I wasn't supposed to talk for a few days, but they said it's not a big deal. I can talk. And I don't feel really bad. I just feel a little scratchy. It's got a little bit sort of swallow, but I'm just gonna rest. Everything went well, and I'm just gonna recover. So I'll see you soon and keep you updated and everything. Good morning. I I'm awake. It's around 7:30. I've been awake since 6. I didn't get any prescribed. I didn't get prescribed any pain medication. I've been just had to take extra strength Tylenol, which honestly I don't really feel like it's working. Um, I'm kind of like at a 4 pain level right now. And I'm just trying to relax. I feel a lot more swollen today. Um, and I just woke up and iced my neck. But I'm probably gonna have a smoothie. I'm probably gonna make myself a smoothie to help chill my throat. I feel like the hardest part of this is not only this, but the inside of my mouth, where the tube had to go down my throat. So, it was just really weird. Um, I'm just really tired. It hurts to yawn. It hurts to put my head back. I feel like I have a hard time eating because there's so much movement in my throat. Um, so I'm trying to do more smoothies for the next few days and do some juices. Um, but I will check in a little bit later tonight. Oh God, I'm so tired. But yeah, I'll check in later tonight. So it's been about 12 hours since 24 hours, right? 12 hours since my surgery. I don't remember. Basically, I had my surgery yesterday, and they said I can take off my bandage after about a day. So I'm gonna take off my bandage and just wanted to show everybody. I don't know what it looks like, so I just wanted to do this in the natural light here. Okay. Just gonna hold my skin down. Just gonna. Okay. So these are just little bandages. They said those would come off probably um, in 7 days. These will just slightly come off, and then I'll be able to peel them off. There's glue behind it, and you can tell I'm swallowing, and my Adam's apple's not showing already. Obviously, I have a lot of swelling. I'm all red from the tape. My skin gets a little bit irritated from any kind of tape, but I also just iced my neck. So now I just wait and heal. I'm gonna be getting some arnica. And my doctor only told me to take extra strength Tylenol, and it's not really working, so I'm trying to get a prescription. Sorry, it's really loud. There's a helicopter outside. So I'm trying to get a prescription, and I'll check in with you later tomorrow. Hi, it's Lola. I'm on day 3 It's early. It's 9:30. Um, and I took out my one of the pieces of tape. I feel a lot better. Um, I still feel like I have a wound. And the swelling is probably at its max right now. Um, you can see it's kind of crusty. And my swelling is pretty bad. But apparently day 3 is the max swelling. Um, but when I talk, I don't have an Adam's apple. It's not moving, which is really amazing. I mean, that was the goal. So I'm probably gonna do a few more check-ins. I got prescribed a hydrocodone or something, and that's gonna really help with the pain. And I've been taking arnica with the swelling and having smoothies and trying to just take care of my body. But I'll check in a little bit later. Hi. Um, it's like almost 8 o'clock and still day 3. The swelling has kind of gotten a little bit worse, but all the bandages came off a little bit slowly. You can kind of see I have a little bit of swelling right here. A little bit of yellow from the bruising. I thought she was going to make the cut a little bit higher, and she actually went lower. But she did it in between this crease right here, which makes me think that she just wanted to be more invisible. Usually people, when they make scar revisions, they try to do them in the crease, and so I don't know. I just think I'm just really swollen. You can tell it just looks like really bad, but I'm just gonna keep icing it and take some arnica, and hopefully that'll help. But I just wanted to check in. I'll probably do another check-in tomorrow night. It's not that bad. My throat doesn't hurt anymore. I'm just chilling and resting, and I'll go back to work tomorrow. Bye. Hi, everybody. I'm on day 4 of my recovery. I think day 4. And the medicine has me so exhausted. I stopped taking it because I had to work today, and and I guess I'm doing well if I can go back to work. I didn't have any problems. I don't know why I put this collar on because it's really irritated. I'm just gonna take this off. My bandages are off. I just wanted to do a close-up. It's a pretty big scar. I was kind of thinking that it was going to be a little bit more invisible, but you see how right here there's 2 different creases. So I don't really have too much on this side. A little bit right here, but this scar will go in the crease, so hopefully that won't be as visible. Like there's like a little line up here, and that's where I thought the original incision was going to be, but I don't know, that was just the doctor's decision. But I'm just gonna do like a side profile. And you can see I'm still really swollen right here, and right in the middle is where it's kind of pulling down a little bit more. I should have just had them do like a neck tightening, but um, I think this is just going to be something that I'm not even gonna notice. Like the further I'm back, the more, the further I am from the camera, the less likely to see. But right now, I kind of have a double chin, um, and yeah. Um, so I guess I'll make another video in a few days. I'm not gonna do it every day because the swelling is really not that big, and it's really minor. Um, but my voice I feel like is better. I'm probably gonna take like Tylenol to go to sleep. Um, but that's about it. Yeah, I'm pretty excited. But other than that, I'm just really excited. Um, yeah, I'll check in a few days. Bye. Hi. I'm on my first week after my surgery for my tracheal shave. Um, I'm just feeling very emotional right now. Um, the recovery's been okay. Um, I just I had therapy today, and I think I'm just really overwhelmed with a lot of the emotional transformation that I'm going through. Um, I'm reflecting a lot on where I was a year ago and 2 years ago as well. I just feel like I'm so lucky to be where I'm at. Um, I'm so lucky to have support, and at the same time, I feel like I'm so far from where I want to be. Um, I feel like things are happening, they're moving really slowly, and it's just feel like it's almost out of reach. Um, Even though I am getting some of my surgeries approved, there's still 6 other surgeries that I am waiting for approval. Um, I filed an independent medical review through the state of California, and they are going to decide if my insurance company is going to assist me with my coverage for the rest of my surgeries. And this is the part where I just have to wait. And it just really sucks to put yourself in a position of vulnerability um, in the public eye. I feel like when I had my surgery, I felt very, very vulnerable. When I was waiting for my surgery, um, a bunch of nurses would come in, and then the anesthesiologists were coming in, and then the doctors were coming in, and then doctor assistants were coming in, and then people were taking my blood pressure, and I had met like 10 people within 20 minutes, and um, I'm not a very extroverted person. Um, when you're going into surgery, you have a lot on your mind. You don't eat. That morning, I didn't take any of my antidepressants that morning, so there was a lot going on, and it was just really overwhelming, um, an overwhelming experience, you know, especially having a transgender body. You're I'm exposing my gender and my genitalia, and um, I'm I'm asleep. My whole body is naked, and there's 10 people in a room all hovering over me, um, and it's very overwhelming. Um, I think it's challenging to be able to be transgender and to have a transgender body and to put yourself in a situation where you're not sure how people are going to respond to your body. And um, of course, in the medical industry, people are going to be sweet, they're going to be nice, they're there to help you. Um, so I think that was very reassuring to know that, because I went to a public facility that specializes in working with transgender people and being trained to help trans people and queer people, um, and people of all different backgrounds. The facility I went to, I think, was very awesome for that. So I did feel very comforted. And one of the first things that I had to do when I was checking in was um, describe my gender pronouns and my name. And so I had like 4 names on my wristband because they wanted to acknowledge me for how I want to be acknowledged, but also acknowledge my dead name. Um, so um, I feel like my recovery has been really hard. Um, I feel like the most challenging part is that I'm a big smoker for medical marijuana, and I rely on it daily. And not being able to smoke medical marijuana has brought up a lot of anxiety. It helps me sleep, it helps with my depression. Um, so I've been going through like waves of emotions because of that. Um, and also just being like very, very um, um, and so I've just been trying to be very, very gentle past few days, and I think everybody heals very differently, and for me, I feel like my pain tolerance is not that high. I have a bunch of tattoos, but the thing about my pain is that I feel like um, someone punched me in the throat, and I feel like I can still feel the tubes um, down my throat, which is a very weird feeling. So it's taking me a while to kind of heal. I think I'll feel better after a while, as the days come through. Um, it is cartilage that is was worked on in the hospital, and cartilage does take a little bit to heal. It's not like bone or skin. So I feel like the outside of and the skin part feels like it's more healed, but the actual cartilage of the Adam's apple I can feel more intensely than the skin healing. Um, I've been using colloidal silver, which is a gel, um, just for the cuts, and I'm just waiting for all of the scabs to kind of clear out. They did make my incision very low, which I was kind of worried about. I mean, I can wear makeup if I want to cover it, but I did get some scar treatment stuff. Um, but I am going to continue getting some surgery. And June 28th, I will get my mandible contouring, which will make a big difference in the lower part of my face. And we will see what will happen about my other surgeries. Um, so, this is my end of my first week check in, and just wanted to give you that progress. There's a lot of swelling still where the incision is, and I've been icing it, but I just wanted to show you one more time. Yeah, so it looks really swollen, and it almost looks like I still have my Adam's apple. So, um, let's see. While the swelling still goes down, we'll see what it's gonna look like in a few weeks.